Let's talk lungs with Trent and Lori from Lung Saskatchewan. Dedicated to connecting you with lung health experts and key opinion leaders who will share current evidence-based lung health information to inspire you and those you care for to take your best breath. This podcast is recorded on Treaty 6 territory, the ancestral and traditional territory of the Cree, Dene, Blackfoot, Saulteaux, Nakota Sioux, as well as the territory of the Métis.
On this episode of Let's Talk Lungs, we are honored to welcome Dr. Jaris Swidrovich. Dr. Swidrovich is a Saulteaux First Nations pharmacist from Yellow Quill First Nation and an assistant professor at the University of Toronto's Leslie Dan Faculty of Pharmacy. He is a national and international advocate for Indigenous health equity and is widely recognized for his work in decolonizing health education, Indigenous health leadership, and the social determinants of health, including those exacerbated by climate change.
This episode of Let's Talk Lungs is proudly sponsored by Boehringer Ingelheim Canada. Boehringer Ingelheim is committed to improving the lives of people with lung disease through scientific innovation, collaborative partnerships, and a deep commitment to equitable care. Their work supports a future where all people, including those most affected by systemic inequities, can breathe easier and live healthier lives. Thank you to Boehringer Ingelheim Canada for supporting this important conversation. Jaris, thank you so much for joining us today. We are seeing wildfires rise dramatically across Canada, and what was once considered a seasonal concern has now become a public health issue year-round. We know that you're deeply engaged in Indigenous health leadership, and we're so grateful for your voice and expertise in this conversation. So let's start with a little bit about you. Can you share a little more about your personal and professional journey with us, how your identity and education have informed your work in Indigenous health and environmental justice?
You bet. So thank you so much again for having me. My name is Jaris Swidrovich. I am a pharmacist and assistant professor at the Leslie Dan Faculty of Pharmacy at the University of Toronto. Saskatchewan is my born and raised home, but I am a member of Yellow Quill First Nation, which is on Treaty 4 territory in Saskatchewan. Although I'm a pharmacist, there's very many overlaps between this space and the work that I do. And simply existing as an Indigenous person, we have a responsibility of ecological justice within our communities. So it's just something that seems to be passed down no matter what, that we need to keep care of Mother Earth. And we appreciate the interconnectedness of all things. So nothing exists in isolation, and I'm sure we'll get into that a little bit more, but certainly also as a two-spirit, queer, and Indigenous person, each of these identities that I occupy seem to be overrepresented among people who are most affected by things like climate change. So I have a deep passion for this and certainly integrate it into my activism.
Well, Jaris, we often talk about air quality when it comes to lung health, and wildfire smoke is now one of the leading contributors to poor air days across much of the country. What exactly are people breathing in during wildfire events, and do we know how this affects respiratory health, both in that short and long term?
You bet. So wildfire smoke is really a complex and harmful mixture of various pollutants. When wildfires burn, they release a fine particulate matter, carbon monoxide, something called volatile organic compounds or VOCs, nitrogen oxides, other toxic chemicals, and especially when structures or plastics or synthetic materials that might be found in housing or structures around the community, this becomes even worse. All of those fine particles are quite concerning because they can penetrate deep into the lungs and even enter the bloodstream, which is, I guess, where I come in as a pharmacist. In the short term, exposure to wildfire smoke can cause eye, nose, and even throat irritation, coughing, wheezing, shortness of breath, and exacerbations of asthma or COPD or chronic obstructive pulmonary disease. We know that emergency room visits often spike during smoke events, especially among children, older adults, and people who already are living with a cardiovascular, like a heart and blood health condition or a respiratory condition related to their breathing. in the more longer term sense, especially if it's repeated, chronic respiratory diseases can develop, even reduced lung function, increased risk of heart disease, and even, unfortunately, premature death. And I mean, this is something that could arguably, I suppose, be prevented. There's also evidence linking wildfire smoke to adverse pregnancy outcomes and neurological effects. So it's a complicated issue. And even when you look at not the smoke, but the effects, the psychological effects, the emotional effects, the spiritual, cultural, community, personal, mental health, everything related to an evacuation, and experiencing this disaster is yet another outcome.
Let's zoom in and talk a little bit about how Indigenous communities are uniquely and disproportionately impacted by wildfires and smoke exposure. Jaris, what are some of the historical and systemic factors that contribute to these inequities?
Oh, goodness. There are certainly many. We know that Indigenous communities are disproportionately impacted by wildfires and smoke exposure for many reasons, but particularly because of geographic location, systemic issues, and even historical factors like you alluded to. We know that many Indigenous nations are located in remote or forested areas where wildfires are more frequent and intense. There's limited infrastructure, underfunded emergency response systems, and even, unfortunately, inadequate housing can make evacuation and sheltering from smoke far more difficult. Some systemic inequities that are certainly rooted in colonialism, and I will always note that colonialism is not an event of the past, it's an ongoing issue, and this plays a major role. So centuries of land dispossession and forced relocation, underinvestment in health services have left very many communities without the resources to respond effectively in times of environmental crisis like wildfires. In addition, access to culturally safe care, air filtration systems, public health messaging is often lacking. And even when public health messaging, as an example, does exist, we often don't find ourselves reflected in that messaging, whether it's audio, visual, or otherwise. It's easy to look at a billboard or catch a commercial or watch the news, but when you don't see anything that resembles yourself, it's easy to look away, and therefore you might be missing some really important information. Even on the health perspective, that burden of respiratory illnesses like asthma and COPD is already higher in many Indigenous communities due to those social determinants of health, some of which I mentioned. And then, of course, the wildfire smoke just makes these vulnerabilities stronger. So we know that Indigenous knowledge systems are very powerful, and we can lean on those knowledge systems to move forward through these wildfires and even perhaps prevent them.
Jaris, let's dig into that just a little bit more and let's talk about access. When wildfires threaten health and safety, evacuation, medical care, clean air shelters, these aren't available equally. So what are some of the real life barriers Indigenous individuals and communities face in these moments?
So, I mean, the access issues are real within this area of focus that we're talking about today, and so many more. We know that many nations are located, like I said, in remote areas with limited road access, even making evacuation logistically challenging, never mind the actual evacuation process, and sometimes even delayed. Health services are often under-resourced or even hours away. Clean air shelters may not even exist locally. Economic disparities strengthen this divide, communication barriers, language barriers. Cultural safety is another critical issue. We know that emergency response plans often overlook Indigenous languages, traditions, and community structures. Often this can lead to or contribute further to mistrust and exclusion. All of these challenges are really rooted in historical and ongoing systemic marginalization, and that is connected to chronic underfunding, of infrastructure and health services in Indigenous communities. But ultimately, all of these inequities and access issues mean that Indigenous peoples are more exposed, less supported, and face greater health risks during the wildfire events. So we know that addressing all these gaps requires not only investment, but quite meaningful collaboration with Indigenous leadership and communities. I often hear talk about co-creation, which is so important, and I agree with that. But then I also ask for a co-creation in a driver's ed style vehicle. So what I mean by that is often when we co-create something, the person in charge still has the steering wheel and the brakes and gets to choose the direction and when we stop and when we go, with us in the passenger seat. We can sit in that passenger seat, but as long as it's one of those driver's ed style vehicles where we too have brakes and a steering wheel, I believe that that's true co-creation and probably the best way to move forward together.
Well, we're going to take just a short break and then steer our conversation back to Dr. Jaris Swidrovich.
Lung Saskatchewan has long been associated with leadership in lung health education. Whether you enjoy webinars, videos, printed resources, or podcasts like this one, we're here to support your best breath. Learn more at lungsask.ca.
Welcome back, listeners. And Jaris, we just finished talking about access and the gaps many Indigenous communities face when wildfire smoke hits. What kind of interventions from government, healthcare systems, and communities themselves do you see as essential moving forward?
I'm so glad that you've asked this question, and honestly, it's always timely, but in my own walk of life and research work right now, it's incredibly timely as a research team that I'm part of based in Saskatchewan. It's a First Nations and Métis research unit. We were just awarded a large $1.5 million grant to look at various health and wellness aspects that Indigenous communities face with respect to wildfires. So we're looking into some of these things right now ourselves. But I know that from governments, we need sustained investment in infrastructure, like the air shelters you mentioned, emergency transportation, housing upgrades. All of these things reflect the realities that we face in remote Indigenous communities, especially. We know that funding must be flexible, directed by communities themselves, and not imposed through the typical top-down model that we often see. Healthcare systems, I'm a broken record on this one, must prioritize culturally safe care and ensure access to respiratory supports, of course, medications, mobile health units, always, but certainly during smoke events. Training providers, all kinds of providers, first responders, healthcare workers, community workers, etc., on Indigenous health perspectives and trauma-informed care. And even to take that a bit further, often you wouldn't need to train folks in these areas at all if they were Indigenous workers themselves, right? So recruiting, retaining, promoting Indigenous peoples in all of the disciplines and professions that are connected to the topic today. Communities themselves are already leading powerful solutions. We know that Indigenous-led land stewardship, including traditional fire management practices, can reduce wildfire risk. Community-driven emergency planning, language-inclusive communication, and even youth engagement are key. A close colleague of mine, Dr. Simon Lambert, who is Maori from New Zealand, has spent significant time in Saskatchewan working with communities on exactly all of these things: youth-led disaster prevention and response, community-led disaster prevention and response, and so much more. So really the path forward must center Indigenous sovereignty or control, knowledge, and leadership. And all of these interventions really aren't just about health, they're about justice, resilience, and restoring relationships with the land and also with each other.
Before the break, Jaris, you alluded to a common theme of Indigenous communities lacking health resources across our country and the importance of culturally grounded care. So what does Indigenous-led health, lung health advocacy, and wildfire response actually look like in practice? And why is it so critical that solutions are Indigenous led?
I often give an example of imagine me, and I'm going to say the word you in a hypothetical you, not either one of you, but imagine me and my family or my community one day showing up to your house, knocking on the door and saying, "Hey, here's a list of best practices that my friends and I have created to help you." And then you would be like, "Okay, who are you? What is this? I don't even know who you are. Like, how do you have these answers?" I've once been to a summit that was titled Solutions to Indigenous Health Inequities, and I was one of two people in a in an audience of 1,000 who were actually Indigenous. It was just kind of wild. So it's important that we keep having this conversation about Indigenous led because it doesn't seem to be happening all the time. But culturally grounded care means centering and privileging Indigenous knowledges, and I pluralize knowledges because we have so many kinds of Indigenous peoples, various First Nations, there's diversity among the Métis, Inuit, etc. Our values, our leadership in every aspect of lung health and wildfire response. So that could include things like community-led air quality monitoring, land-based healing programs, and integration of even traditional medicines alongside the Western respiratory treatments that I know about as a Western trained pharmacist. Indigenous-led advocacy, which would involve training and empowering local health workers, creating educational materials in Indigenous languages. And I'll also note that it's important that when our languages are reflected in materials, that it's not just in writing. Many of our people hear it and see it. So a video or audio in that language would be more effective than a translated brochure or paper or website. Even designing emergency plans that reflect community priorities and cultural protocols. So doing all of this together, like I mentioned, needs to be a co-creation. I don't know that it even should be like one side or the other, if I can call it sides, but a true co-creation in that driver's ed style vehicle where we've both got a steering wheel and we've both got the brakes and move forward in a way that does not have an inherent power dynamic. Um, and if there is any power dynamic, it should be the other way around, right? When we're focusing on Indigenous communities. So if we don't have a driver's ed style vehicle, then put the community in the driver's seat and the rest of the folks in the Western colonial system in the passenger seat.
Earlier in our conversation, you referenced youth in terms of interventions and solutions. We also know that Indigenous youth are carrying both the burden and the leadership of climate justice. What are some of the ways youth are organizing around the issue, and how can healthcare professionals and organizations like Lung Saskatchewan be better allies?
I have a lot to say and think about that. And even I'll make a note in my promise to my colleagues on even the term allies. I don't really have an issue with that term. However, many others do. And they talk about moving that term into something like an accomplice or a co-conspirator, because often an ally might just, be standing back there with the philosophical support, but are they knocking down a door and making space and paving the way for something to happen? So that involves a little more action than perhaps an ally. But I mean, we could talk about terms as much as we want, but I just wanted to note that piece. Indigenous youth absolutely are at the forefront of climate justice. They combine ancestral knowledge and really bold activism. I think we're in a really cool time period with social media and the way that we're all connected because they can create power in numbers quite easily. I think back in the day, it would be door to door, right? They'd have to try to find each other some other way, but social media can bring them all together in a really effective and even quick way. Healthcare providers and organizations can be better allies or accomplices or co-conspirators by listening, funding, and even sometimes stepping back. I think that that's contrary to the central aspect of so much of healthcare. I think that for folks like myself and pharmacy, we want to step in, right? We've chosen these disciplines to step in and do something and help. But sometimes helping in the best way means stepping out, stepping away, and letting the Indigenous community, the youth in this particular situation, completely lead the way. It means addressing systemic racism within healthcare, creating culturally safe environments where youth feel seen and respected. I even think about my own discipline of pharmacy in a province like Saskatchewan. If I can draw what I'm about to say to the issue of wildfires and medication access and medication reviews, we're still at a point in Saskatchewan where there's something called the Saskatchewan Medication Assessment Program, or SMAP. And folks, as long as they meet certain criteria, like being 65 years of age or older, on chronic medication, a recent chronic disease diagnosis, or a recent discharge from hospital, they're eligible to sit down with a pharmacist for up to an hour for a massive comprehensive medication review, along with 2 follow-ups in that calendar year. If you have a status card, though, you can't. So in Saskatchewan, that's an example of systemic racism, right? The literal system is saying we have this service to offer, but not for you because you're a status First Nations person. So that's another way that healthcare workers can support. Although medication reviews aren't specifically about wildfires or lung health, they're also not. They're very much connected in
Mhm.
that way. So we have a lot that we can do in this space, and yes, including youth and all of that.
Yeah, we can certainly still have some hills to climb in that regard, Jaris. So, what about solutions that center healing? We often hear the term, and I've heard you use this term before, two-eyed seeing, the integration of Indigenous and Western knowledge systems. What would that look like in the context of wildfires and lung health?
Great question. And I will first respond to something about the two-eyed seeing framework or philosophy, and then get into what it is that you asked. I'll note that for listeners, or really for anybody, that although the philosophy and framework and sentiment behind two-eyed seeing is absolutely applicable, and I'll get there in a moment, I do want to highlight that it's a Mi'kmaq term and a Mi'kmaq philosophy. So the First Nations of the East Coast. So this was a term that was translated into English based on a Mi'kmaq word from a Mi'kmaq elder who talked about two-eyed seeing. So as a human being, and even as an Indigenous person and as a researcher, I don't use that term because I'm not Mi'kmaq. Maybe if I was working with Mi'kmaq folks, I would use it, especially if it was at their request. So what I, just on a personal level, do choose to use is a more prairie-centric term that really brings in the same sentiment, and that is called ethical space. And this was coined by someone named Willie Ermine. In fact, there's a lot of really beautiful videos on YouTube that anybody can look up about Willie Ermine and hear it in his own words. But if you can basically picture a Venn diagram of one circle being Western knowledge systems and the other circle being Indigenous, the spot where they overlap in the middle would be the ethical space. We're able to have frank, straightforward, respectful, non-privileged, non-hierarchical discussions about whatever the topic is at hand. And that really is also what two-eyed seeing is saying, just in a different way, and not wanting to use a Mi'kmaq term for myself. I'll even add that two-eyed seeing can even be seen as an ableist term. For example, even a chief I work with quite literally has one eye. So how dare me, talk about here's this two-eyed seeing model and present that to the chief. So I tend to not use two-eyed seeing, but the concept and philosophy behind it, absolutely. So in the same way that we were talking about that vehicle and the co-creation, that can also be applied in that same way too, right? Each of these circles, Indigenous and Western knowledge systems, must come together in an equal way. We each have the steering wheel and we each have the brakes. it's so important that we move ahead in this way because there's been, unfortunately, such a long history and even ongoing process of things being done for Indigenous peoples and for Indigenous communities. And even when they might be very well intentioned, sometimes it's still not right, right? I might have the best intentions that day that I knock on your door and say I've solved your family's health issues, but that doesn't make it right, right? So that's hard for people to get sometimes because they're moving forward in the right way. Their heart and their mind are in the best spot, but uh, there still needs to be a part of, stepping away, applying that ethical space, whether you call it ethical space, two-eyed seeing, or a driver's ed learning vehicle. I think that the concept remains the same.
Well, Jaris, as we get to the end of our conversation, what gives you hope in a time when climate change, colonialism, and health inequities intersect? Where do you find the light?
There's light everywhere. There's so much strength and brilliance and love. I think that's a word and concept that we often leave out of like professional conversations and classrooms and programs, but love. There's so much of this in our communities and seeing the way that we all band together in the good times and the bad and the stressful. It really does give me a lot of hope and light. I look at some communities like Montreal Lake Cree Nation, for example, years ago when they were evacuated, a forced evacuation because of wildfires. At the time, there was no known issue with crystal meth. You might wonder where I'm getting at, but give me a moment. So when this whole community was evacuated, they were evacuated half into Prince Albert, Saskatchewan, the other half into Meadow Lake. And upon returning back to their community, over half of that community was now using crystal meth. And that wasn't an issue before. So what often ends up happening is then, a finger of blame or pointing the blame goes on these individuals, but you need to go back to every single step. Well, no, this was because of the evacuation. This was the influence that happened in those cities and places. They had to be evacuated because of wildfires. There were wildfires because of climate change. There's climate change because of colonialism and resource extraction. There's a huge long list that goes behind all of this. But despite all of that, Montreal Lake Cree Nation responded to what their community needed. They opened the first crystal meth detox facility that was land-based, trialing a whole bunch of new types of interventions for people who are withdrawing or detoxing from crystal meth to restore that health and wellness back into their community. So despite this massive tragedy, despite that massive impact, they still worked through it, and it was entirely community-led. So seeing examples like this pop up throughout the country, Indigenous folks within Canada, the United States, and beyond, just gives me hope that I know that we're not going to just end wildfires, for example, like this year or next year, but I've seen enough evidence that we will get through it, and we will find solutions together. So I do see a lot of light, and looking at the youth, like we've talked about already as well, that gives me a lot of hope to see their massive commitment to environmental justice and activism. It's not something that's just been left with a particular generation, but absolutely passed on.
Jaris, thank you. You are so welcome in our circle, and we would be proud to be your co-conspirators anytime. Your voice and leadership and advocacy have given us a lot to reflect on, and not just in terms of respiratory health, but in the responsibilities that we all share in truth, reconciliation, and climate action. Thank you so much for being with us today on Let's Talk Lungs.
Thank you.
Thanks for listening. If you enjoyed this episode and you'd like to help support Lung Sask's Let's Talk Lungs podcast, please share it with others. Post about it on social media. Like, subscribe, hit that notification bell for new episodes, and leave us a review. Follow Lung Sask on Instagram @LungSask and on X @LungSask. That's all for this episode. See you next time.
produced at
Sound Lounge by T-Bone.